Hello, this is Lowell City Manager Eileen Donoghue bringing you an update on the city's response to the COVID-19 crisis. The availability of a safe and effective COVID-19 vaccine is undoubtedly an encouraging sign after the months of hardship inflicted by this devastating public health emergency. We recognize, however, that rapidly evolving information regarding vaccine distribution has caused widespread frustration and anxiety here in Lowell and around the nation. With this in mind, I wanted to provide an update on the status efforts being undertaken in the City of Lowell to ensure that residents are able to access the vaccine as it becomes more widely available. In Massachusetts, vaccines are being distributed according to a three-phase timeline. Most residents will be eligible to receive the vaccine during Phase 3, which is tentatively set to begin in April. Certain priority groups are eligible to receive the vaccine sooner. On Monday, Governor Baker announced all residents aged 75 and older will be eligible to receive the vaccine beginning Monday, February 1st, marking the beginning of Phase 2. While the eligibility of this high-risk population is a positive development, it is important to emphasize in the context of this announcement that the supply of vaccine doses remains extremely constrained both in Massachusetts and nationally. This supply shortage translates to significant limitations to the number of available vaccination appointments across the state. Residents over the age of 75 may have to wait several weeks for an appointment. Here in Lowell, we have activated our vaccine clinic at the site of the Lowell Senior Center and are filling appointments for eligible residents next week. Appointments for this site must be made online at maimmunizations.org. Available slots for next week filled up quickly, but new appointments may be added periodically, so check back often. The number of appointments available at this site is limited based on the allotment of doses that the city receives from the Commonwealth. Next week, we intend to administer 400 vaccinations at this site. We are aware that this limited quantity does not nearly meet the demand for vaccinations among eligible residents in the city. However, looking ahead, our health department is prepared to act swiftly to scale up this site to administer as many doses that the city receives. As vaccine supply remains limited, our priority in the city is establishing the infrastructure and plan that will be needed to conduct a high volume of vaccinations when more members of the public become eligible. The city has partnered with Lowell General Hospital to support their effort to stand up a large-scale regional vaccination site here in Lowell at 1001 Pawtucket Boulevard. It is anticipated that this site will open in mid-February. It will serve residents from all of the Greater Lowell region and is expected to ultimately have the capacity to support several thousand vaccinations per day as supply is increased. More information on this site will be announced in the coming days. The Baker administration is working tirelessly to improve the statewide distribution infrastructure and is bringing new vaccination sites online regularly. When doses become more widely available, it is anticipated that residents will be able to be vaccinated at doctors' offices and pharmacies, in addition to large-scale public sites. Currently, eligible Lowell residents can set up appointments at several super sites that have been stood up around the state at locations including Gillette Stadium and Fenway Park. The closest super site is located at the Doubletree Hotel in Danvers. These sites are receiving a high volume of vaccine and will have many appointments available over the coming weeks, making them a good option for residents with access to transportation. A list of these sites and all other public clinics in Massachusetts is available at mass.gov/COVID vaccine map. Clearly, there is a long road ahead in the vaccination process, and while we are all eager to regain a sense of normalcy, patience is going to be critical in the months ahead. In the meantime, with relief on the horizon, we cannot let our guard down when it comes to preventing the spread of COVID-19. The risk of transmission remains high across Massachusetts and here in Lowell. This week, total cases in the city surpassed 13,000 since the beginning of the pandemic. The 14-day positivity rate of Lowell residents tested is 8.37%, which represents a modest decrease, but is still alarmingly high. So it is imperative that we do not let up on wearing masks, social distancing, and the other practices that have proven effective in slowing the spread. As I mentioned, information about vaccine distribution is evolving quickly, so stay tuned for updates. The city will be conducting extensive outreach to make residents aware of the pertinent developments in the months ahead. For up-to-date information on the status of the vaccination locally, please visit lowell.gov/COVID vaccine. Thank you and stay safe.